likes
glamour, runway, style, fame.
She likes gossip. She likes
Boys, parties, style, fame.
Hi, and welcome to another episode of NIU YU. On tonight's show, we're going to be discussing male sexual dysfunction, as in erectile dysfunction or ejaculatory dysfunction. Mr. Mercia, tell us, obviously this is quite, we seem to always talk to you about touchy subjects when it comes to males, and obviously this one I would say would be the touchiest of all. But can you tell us a little bit about the problems that some men do encounter?
Once again, first of all, thanks for inviting me.
Thank you for your time.
Once again, it's touchy because it might be a bit embarrassing.
Yes.
But it shouldn't be.
Yeah.
Because around half of males aged around 50, 45 do tend to suffer from problems with erection. And there is also a perceived erectile dysfunction, because sometimes males might think that they do not have erection which is good enough, when this is something which is really a perception.
Okay, so a lot of it is psychological then?
Well, let's say half of it. Okay, then there are diseases that can cause problems with erection. Okay, like diabetes, hypertension, blood pressure issues, they definitely contribute to problems with erection. But before going into erection, I would like to classify the sexual function of males, because there are problems related to libido, which is the heat, the want for intimacy, erection, which can be something related to something erotic. Or
so you can have the want, but not get the erection.
That's it. And there is something which is called physiological erection, which happens at any age group, even babies and kids.
Yes, with little boys in the morning.
And it happens in males at night. There are certain patterns during our sleep which cause erection in the penis. And first of all, erection is really an increased blood supply in the penis and a decreased drainage. So there's blood going in the penis
and not coming
out. Then there's ejaculation, which again can be a result of sexual stimulation or something which is physiological. Sometimes there are wet dreams in boys, you know, and that has nothing to do with eroticism. Okay, and then there is orgasm, which is the climax, which usually follows ejaculation.
I didn't know it was so complicated.
And that is, no, because these are processes which usually come one after the other.
Right.
But they are separate processes.
And separate issues.
That's it. So there are males that, let's say, ejaculate without feeling the pleasure, the orgasm, the climax. Or else there are males who ejaculate without having the erection.
Oh my goodness.
Okay? And you have to, first of all, be patient, give enough time to the patient.
To explain. To
explain in a free manner, to speak openly about the problem in layman's terms. Okay, and that is what my aim is, that these issues are issues which for me it's like discussing headaches.
Of course.
Okay?
Yes.
And erectile problems, previously known as impotence, it means that the penis is not erect enough to penetrate during sexual intercourse. And it is something that usually bothers the couple. Questions will be asked, and the more it bothers...
Because sometimes then the female would think that the male is being unfaithful.
Obviously. And sometimes the more that it bothers the male or the couple...
The more of a problem it becomes.
That's it. So there's a definite psychological issue. But then there are some things which are related to organic problems, like diabetes, which I said might affect the circulation of the penis, like it affects other places, you know, diabetes, the circulation, it might affect the legs, but it might affect the penis. Heart problems and the treatment of blood pressure, these are all directly related to erectile dysfunction.
Right.
And erectile dysfunction is common, 50% of 50-year-olds.
Oh my goodness.
Sometimes much younger. Okay,
So
as well.
really what we want to get across is that, first of all, it's nothing to be ashamed about or embarrassed
should
about,
talk
to
about
talk
it.
about it.
Yes,
To
yes.
talk about it with, obviously, your doctor, and in this case, a urologist is the person to talk about
Yes.
to.
And sometimes we refer them to a psychologist if it's a psychological issue, you know.
Yeah. Also, I think to have the communication with your partner as well.
Definitely.
That you can discuss that so that you don't have situations
And
whereby...
clean any and remove any perceptions that are brought about, you know, unrealistic issues with performance, let's say.
Okay, so when you're 50 plus, you're not going to perform like an
And
18-year-old?
And even 18-year-olds, they do tend to think that there are some perceptions about the length of the erection, the time to ejaculation.
Yes.
I mean, most of the issues are really issues about perception, about what should be.
It's funny, you know, this perception as well with young people, because now in schools there's so much being done about sexual education, and they're teaching children so much, but they don't go into this kind of thing. They go into a lot of general things, but yes, but they don't go into this, and it's something I think that even sort of like from a young age that they should have, because teenagers do have a problem.
It is part of the body.
Yes,
there's nothing wrong about it. It happens.
It's not
happens
embarrassing.
to everybody, and I think we should speak more about it, and especially we should speak more about it before the male and the female start a relationship, because sexual problems happen in a relationship, and they should be prepared to
deal with them.
Yes, that's it.
Okay, so let's say, for example, somebody has come to you and has a problem with erectile dysfunction. What can be done about it?
First of all, as I said, we have to differentiate what the problem is. Is it a problem with erection, with libido, with ejaculation?
Right.
Because another problem which is related is premature ejaculation. So they come early. And again, what is early? What is your perception of coming early?
Yes.
Is it 1 minute, 2 minutes? The average is around 2.5 minutes from penetration time to orgasm. So what is the perception of that man? And obviously, if the man comes early, then you might think that this is a problem with erection.
It can also be a problem in the couple together as a couple,
definitely,
correctly?
Definitely. But if the man is ejaculating early, then the problem is not erection, because obviously after ejaculating, there is a time when normally there is no erection. So when the male is ready, when there is a climax, when there is ejaculation, then the body
becomes
there
flaccid.
is around 20 minutes. That's it. That a man cannot become erect.
Of course.
So the first thing is to differentiate between them, between premature ejaculation and erection, erectile problems. Then you take a history for the comorbidities. That means whether he has any other problems, whether this is a sign of a problem with the circulation. Because sometimes erectile problems are a sign of problems with the heart, which is obviously more serious, you know. Any treatment that he is on, most treatment for blood pressure treatment is notorious for causing erectile dysfunction.
Because blood pressure treatment thins the blood, so
No,
you'd
because
have...
it's a direct side effect, basically.
Okay.
So you have to... sometimes the treatment, the management should be in liaison with a cardiologist or with a doctor who might tailor his medication, the patient's medications. And then there are 90% of the patients do well with pills. You have a percentage of them which need psychological help or couple issues which need to be dealt with psychologically.
Yeah.
And then the rest which have an organic problem tend to do well with pills.
Okay.
And the pills are safe, they're well validated, they do have side effects and there are contraindications, but usually they are safe. They are medications, they should be prescribed by the doctor, and they should never be bought online.
Of course, because now a lot of people are doing this buying online, which is very dangerous.
First of all, the patient should be assessed. They are contraindicated. Patients who have a history of heart problems, especially recent heart problems, and who have not been treated for it, let's say angina, should not take them. And the issue is not the pill themselves, it's the exertion which is related with sexual intercourse that might cause problems with their heart. But then, excuse me, but then there are the pills which cause improvement in the erection are contraindicated with some pills that are taken for angina and heart attacks. So basically pills like nitrates or the pill which is taken under the tongue for angina should never be mixed with any pills which cause improvement in erection.
Okay. I think though that's something though that sort of the patient or anybody watching who might have this problem would really need to sit down and maybe possibly even take notes with their own doctor, because it's hard to take that all in. So ejaculation problems, yes.
Ejaculation.
So what sort of treatment is there for that?
Yes, usually it comes at a younger age group. It can be there from the teen years. So basically you have males that always ejaculate early, and it causes lots of frustration and couple issues, obviously. And there are some psychological problems that need to be dealt with, couple management and pills.
So ejaculatory problems can also be organic?
Yes. They could be organic, related to nerves, because ejaculation is related to nerves that will time the release of semen from the prostate. But there are pills which also delay the ejaculation, and it might double the time.
Okay.
So let's say usually premature ejaculation is very frustrating, because it could be that they last only seconds once they penetrate. And so doubling the time will not make it much better. But it is fast acting. So you take the pill and the ejaculatory time
is increased.
And the pills are different from the pills used for erection. Ideally, this ejaculatory thing should be dealt with by the couple by, let's say, prolonging the foreplay.
It's a very, once again, every time I talk to you, it's always very complex, and I learn more and more how vast this whole subject is, and that we could go on and on together. But I think that for today, what we need to get out of this is that, first of all, what's really important is communication and openness between the partners, between them. Whether you're two males, two females, male and female, that you have the ability and the confidence to be able to talk to each other. Secondly, there are many ways of being intimate, not only sex. So if there isn't some kind of solution to your problem, which is highly unlikely, it's not the end of the world, and there are other ways of being intimate and close with your partner. But if you do have a problem or experiencing any of these problems, to pluck up the courage and to actually go and see your doctor about it, because most of the time there is something that can be done. Thank you very much, Mr. Mechia, for joining us, and we look forward to seeing you again.